I'm a receptionist at the Southside Clinic, and when we started using Centricity EMR in our clinic environment, we developed lots of workflow efficiencies. The workflow efficiencies begin right where I work at the front desk. As soon as a patient arrives, like Debbie Enders has just come up to the desk, I can signal her arrival to the nurse automatically and quickly without contacting her. All I need to do is check off her appointment on the appointment schedule, and that process begins the creation of an office document, pulls her chart, routes it to Lynn Marks, the nurse, and sets it up as a patient to be seen by Dr. Winston. Our office schedules are all automatically updated to show the fact that she's arrived by changing the color of her appointment blue. So there's no communications required between us in a personal or direct way, and there's no flags to move forward or some electronic lights for people to pay attention to. There are a couple of other huge time savers that have come to my workflows, one of which is handling phone messages. So if I'm receiving a phone call from Billy Pendergast's mom, I can quickly look up his chart, open it, and begin a phone note to let Dr. Winston and his office staff know that there's been a call from his mom. I can document when she called, I can take the call, I can say that this is a sick call and that Billy has sore throat and fever. I can then route that phone note directly to the nurse without having to find her, and when I put it on her desk, I can put it on his desk as well. And when I put it on hold, the note shows up on both of their desktops so that they can handle this phone call, phone back Mrs. Pendergast, and decide whether Billy needs to be seen in the office. Just as quickly, I can handle refill requests that come in from the pharmacy, either by phone or by fax or from the patient. So if Debbie Enders needs to have a refill for her medication, I can quickly choose a refill request, know that that's for Dr. Winston, and find out that she needs to have a refill on her glucophage. Her medication list automatically comes up. I can then send that refill request off to Dr. Winston the same way I did with the phone note, and it's already on his desktop waiting for his approval. So there's no more chart pulls, no finding the nurse, no finding the doctor. I save at least 3 minutes for every prescription refill request or phone message I handle.